If you are worried you have Lyme disease, or just like the outdoors, and want the peace of mind of knowing whether you have Lyme disease or not, there is a new Lyme screening test based on decades of research by Dr. Richard Marconi, a professor at VCU Medical Center. For more information, visit glymedx.com, that's glymedx.com, or email at info@glymedx.com.
Infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Hey everybody, this is Robert, and welcome to Outbreak News Interviews. I appreciate you listening once again. Now, according to the CDC, on any given day, about 1 in 25 hospital patients has at least one healthcare-associated infection, or an HAI. Did you know that hospital-acquired infections are the nation's 8th leading cause of death, just behind diabetes and just ahead of flu and pneumonia? Now, my guest today survived a very serious HAI and septic shock and is here today to tell her story. Joining me now is Mary Millard. Hi, Mary, and welcome to the show.
Hi, Robert. How are you? I'm very pleased that you're letting me speak today.
Oh, I'm more than happy. I'm glad you're here. And I'm really pleased to have you here to tell your story. I saw tidbits of it on your blog and stuff that you post online, and I really like the audience to hear what you have to say. So I'll just go ahead and give you the floor.
Oh, certainly, Robert. Thank you. Yes, and as a survivor, I think it's extremely important to speak out if you're possibly able to. Was a very healthy 55-year-old in 2014 and had some symptomatic AFib and was diagnosed after going to the emergency room with an ascending aortic aneurysm that was quite large, and my aortic valve had also collapsed. And they were planning to do an open heart surgery, and this was a surgery I was told was very common. They'd done hundreds of them. They would just graft out the aneurysm, replace it, and replace the valve. So I thought 10 days later I'd be home and see a cardiologist once a year. But a day prior to the surgery, I went into cardiac arrest, and I was told this was due to the backwash from the collapsed valve clogging up. And subsequently, I coded, which is a medical term for that you're flatlined or you're no longer beating your heart or breathing. And I was placed on what is ECMO. And ECMO is basically life support, where a machine beats your heart for you, breathes for you, and circulates your blood for you. And I was on that roughly about 3 days, and my own heart started beating again. And then after that, I had the open heart surgery 2 weeks later after recovering a bit because they were afraid that the aneurysm was going to burst. And they were scoping a little camera down there every day and very nervous. I had the surgery, and everything seemed to be fine according to my husband. I was pretty much out the whole time. But he said I was in final step down, and I was speaking in a confused manner. He said I really couldn't hold my head up, and he thought I was on some medication. So he asked a nurse, and she said no, not anything that would do that to her. And the shocking thing is about it is they called a stroke code, which delayed any possible diagnosis of what they call sepsis by about 8 hours and delayed antibiotics by about 8 hours. And since World Sepsis Day is talking up, I just quickly wanted to take a sidebar here and discuss what is sepsis. A lot of people may know, but a lot of people may not. And it's sometimes called by the medical community septicemia or bacteremia. And what that basically is when a bacteria, a virus, or a fungus enters your bloodstream through a break in the skin. Now, it can happen out in the community through cuts and things like that, but a lot of them are caused in hospitals by surgical incisions or what they call a breach of mucous membrane, capillarization, something like that. And basically, sepsis, when your body sees this bacteria or any other pathogen coming, your immune system kicks into hyperdrive, and it starts to protect the organs, not sure what to do with it. So the result is your organs start shutting down. And what happened to me was that by the time they diagnosed the sepsis, about 8 hours later, I had started to go into acute septic shock, and my blood pressure dropped incredibly. I got cyanotic, which is where your feet and hands don't get any oxygen and they turn blue. Your body starts shutting down things that it doesn't need to keep your core alive. My hair fell out, and I basically lost the ability to speak, or I had vocal cord paralysis. So this result of this pathogen doing this to me, what they did was they did a culture. Of course, the culture takes 48 hours to come back, and it came back with Pseudomonas aeruginosa, which is very rare to get surgically. It's commonly in water systems, and it's done when things are washed, but with a surgical incision, it's pretty rare, and it's what they call a gram-negative pathogen. It's just how they check the virulence of it and check how they find it with a gram stain. But this pathogen, basically what they decided was that they had to open me up a second time, again in the chest area. And what they tried to do, because they were afraid that a biofilm had started to form, which Pseudomonas, along with other pathogens, create a sticky substance that sticks to anything that's not your DNA. And so they debrided or scraped around the graft and cleaned up the chest area, and that resulted in them taking some of my abdominal wall to put up there to nourish the surgical site. Post-sepsis syndrome is a thing, and that's kind of what happened to me. They were going to take my left foot, but luckily they didn't. It's permanently numb. My feet and hands tingle constantly. My hair has never been the same, and I've had some nerve damage in the vocal cords. So that is something that lives with me, unfortunately. And what this basically did was this resulted in another extra 5 weeks in the hospital. It took a long time to come back from it, and my husband was told every day, your wife is going to die. So he ended up quitting his job because he did not get enough FMLA time to care for me or to be at the hospital. And he was there every day. When I got home, I had to learn to walk again due to 2 months in the bed and a medically induced coma. And I also had to endure home infusions. After the antibiotic therapy was done in the hospital, they continued them at home for a complete month. And these were heavy-duty antibiotics to keep it out of my blood and keep it down. So what happens, too, is that the antibiotic therapy, especially tobramycin is a common antibiotic, it causes tinnitus terribly because it kills the little hairs in your ear. So I have permanent tinnitus resulting from that. I was put on Cipro, which is an antibiotic, a very strong antibiotic. At first, I was put on 1,000 milligrams a day, and unfortunately, the Pseudomonas worked its way around that 1,000 milligrams and came back into my bloodstream in June of 2015. And once again, antibiotic therapy, a month of home infusion, and now I'm on 1,500 milligrams a day. And I've been on this for a little over 2 years.
Wow.
Cipro, as many people are very familiar with Cipro, it causes a lot of issues. I've had joint pain, photosensitivity. It reduces your kidney function, causes muscle pain. Most recently, it causes, especially in older people, and I'm nearing 60 now, it causes plantar fasciitis, and it ruins your Achilles heel tendons. And my right tendon was starting to tear, so I'm in a boot right now to help that heal, and then they're going to put a permanent foot brace on so I cannot bend my foot. And this is just part of this. Some challenges from this really are paying for the Cipro. My insurance policy does not pay for long-term therapy, and they pay for short rounds. And part of this comes from, according to their website, about the new push to reduce antibiotic use. And unfortunately, in my case, it keeps me alive. So this is something that's frustrating. Runs $300 to $400 a month. I have to endure monthly blood cultures and blood tests to make sure that it's still suppressed. I've been banned from driving because Cipro causes sleepiness and cognitive issues, where I've become forgetful and I get these foggy moments, especially when I'm not really engaged. That happens. And I've been forced to take disability, which is really upsetting for me. I've always been a productive citizen. I have completed a master's degree that I really can't use, and my life has really changed because of that, and especially learning that the Pseudomonas will win in the end. My infectious diseases doctor told me it will eventually override this 1,500 milligrams, and then there's nothing they can do. They just don't know. It's a matter of when.
So Mary, you're expected to be on Cipro the rest of your life?
Yes, whatever is my life. And this is a huge problem. A lot of people are familiar with the black box warning, fluoroquinolones and everything, but the problem is I have no alternative. It's the only oral medication that will suppress Pseudomonas onto its biofilm. So every day, 7:50 in the morning and 7:50 at night. It's tough. It's very tough. And it requires monthly visits to my infectious diseases doctor to monitor what's happening. And in the past 2.5 years, I've been hospitalized 8 times. The Cipro causes a huge imbalance in your system because it kills all good bacteria, but it doesn't kill all bad, so some do get in. I've been hospitalized for respiratory infections, trachea infections, and intestinal infections. Now it's starting to cause my heart to fail. Recently hospitalized for a pacemaker, a small micro pacemaker that lives in my right ventricle. And, the medication itself it is everything it is said to be in the media and the press. And unfortunately, it's the devil that's keeping me alive.
Mary, can I interrupt for a second?
Certainly.
Would you say that your case is typical or atypical?
It's very atypical from what I understand. I can tell you, Robert, I've actually looked around for survivor groups, support groups, the Pseudomonas survivors, and there's support groups out there for other types of pathogens and HAIs. I had asked my infectious diseases doctor, who's well known around the world, and he said there is nobody. He said this is very atypical. He said Pseudomonas recipients, they just die in the hospital. That's all they do. He says that you're the only survivor, especially that's lived this long, that he knows of. So it's very atypical. And I don't know. I asked him about the Cipro, how many people take this for life. He says much lower doses if they have staph or MRSA in a colonized way. He says they can take it at much lower doses and for shorter terms. But, this is a particularly nasty pathogen. It's very virulent. It has a lot of things that it does in your body. I've actually endured so far 67 X-rays, 14 CT scans, and 23 additional procedures just to monitor what the Pseudomonas is doing to the graft and the valve. I was told that it would eventually try to eat through the graft, and this is something they're afraid of, and so I get a CT scan about every 6 months. And, it's costly, too.
Sure.
And not just costly to me. Yeah. And the hospital has written off about $2 million on me so far. I don't know if they feel guilty that this happened to me, or if it's something, I know I'm a research patient. I'm not sure if that's what it is, but a lot of insurance companies won't pay hospitals anymore for what they consider their fault, which is what infections fall under. Excuse me, had to get a little drink of water here.
Sure, no problem.
Yeah, but it actually cost me, us too. The additional out-of-pocket costs, the hospital that I go to is an hour away, so we have fuel expenses. I have to buy all kinds of probiotics and specialized foods so I can try to replace some of the gut microbiome that I've lost.
Sure.
So that can run into quite a bit of money. But the biggest thing, is the life changer, what it does to your life. I really can't do a lot of things I enjoyed anymore. And before this all happened, I ran, I played beach volleyball, I rode horses, we live on wonderful acreage and have a sporting dog, and I used to run with her. And cannot do that anymore due to the joint pain and the tendon issues and the fatigue that I feel from the medication. And my life has basically become, doctor's visits, hospitalizations. I think about this day and night, and it's very frustrating. And driving, no more. We live rurally, so no more just running out to the store. So it's frustrating, but.
Okay.
Go ahead.
Yeah, I just need to get to my advertiser real quick.
Oh, sure.
For many years, we have been waiting for a Lyme disease test that actually works. After decades of research by Dr. Richard Marconi, a professor at the Medical Center at Virginia Commonwealth University, a breakthrough test has been developed. The GLD test, recently launched by Global Lyme Diagnostics, is based on Dr. Marconi's science. For more information, visit glymedx.com, that's glymedx.com, or email them at info@glymedx.com. Mary, did you have more to tell us about
I actually,
your situation?
yeah. Oh, certainly. Well, the situation, not so much. That was basically what happened to me.
Mm-hmm.
But, I have actually kind of started a new, I want to say profession, although I'm not paid for it. I've actually become an advocate for speaking for patients with HAIs. And this kind of came through a convoluted tunnel through my infectious diseases doctor. Mm-hmm. The IDSA, which is the Infectious Diseases Society of America, was looking for patient stories. And he said, well, here's their email, talk to them. And they did a little interview, and my story got into their quarterly journal. And from there, one of them contacted me and said, well, hey, would you be willing to speak to a group about this? And I said, oh, well, certainly, what do they want to hear? And I wasn't really sure how to begin, and this has kind of developed out of doing this now and again. But I ended up speaking at their staff meeting. What their thought is that if you remind people that there's a human face to this, that there is family to this, and you're a person first and a patient second, that it really spurs researchers, to even go further. And I've really found that to be the case. I've actually started a blog and an organizational Facebook page, an ID page, where I kind of, I've become a kind of a nerd. I used to be a nurse and kind of became a microbiology nerd, started researching Pseudomonas and infectious diseases through Coursera, and got a few certificates and, got excited about it because I wanted to know what this was in me. I really think people should know what is causing them their issues and learn how to deal with it. I think that's very important. But I've spoken to a healthcare services summit in Texas where the stories seemed to be very effective. People were actually very moved and said that they've looked at so many statistics, they didn't even think about the patients behind it. So it's become a real passion of mine to get the word out. I'm actually going to IB Week for the Infectious Diseases Society of America in October to talk to drug companies and tell my story to them.
Oh, fantastic.
But, yeah.
And how's your family handling all this?
Well, not so well. I've got some that are in denial, that this isn't so bad and it's okay what I have. I have actually, my husband actually had a little bit of PTSD after all this, and he really doesn't do well hearing that I may not be here someday. It's very hard on him. We met later in life. We've been together 15 years, and it's something that it's one of these things, well, I don't want to talk about it right now. I've done a few what I consider morbid things. I've prepared a folder for him with all the bill, things in it and the passwords for everything.
It's got to be done.
Got to be done, because I realized when I went in, after I came back, he said, I barely managed. I didn't know what to do and who to pay and how to pay them. And so I've really, really prepared this time. But what I wanted to encourage people to do was I actually had figured out there really is a lot that patients can do themselves if they are aware and with it when they go into the hospital. My case was a little different. 3 days in, and then I was out for 2 months, so I couldn't really speak for myself. So it's very important, if you can, to have a friend, a family member, to be your advocate in the hospital. But some things that patients can do to help stave off infections just in their room. A lot of hospitals are advising you don't bring flowers or plants anymore because they carry bacteria. It says if you're going to bring something, bring wipes. That's a nice gift. Some Clorox wipes. One kind of trick that a doctor actually told me was when you're eating, you have your bed tray and your bed there, and sometimes you might be doing something, and you lay your fork or your knife down on your bed sheet. He said, don't do that. He said C. diff, which is a intestinal infection that's rampant in hospitals, lives on sheets and can live on bedspreads. Don't put your utensils on them. They also, I don't know about other hospitals, but 2 or 3 here in North Carolina have gone to doing linen changes once a week to save money on laundry. But you can ask to have your bed linens changed every day, and that is something you should really do. Make sure all the doctors or anybody who comes into your room uses that hand sanitizer or washes their hands. I've seen groups of doctors. I go to a research hospital. Doctor comes in, but there's 10 residents behind them. So every one of those people, I make sure every one of those people has used that sanitizer. And, ask for the doctor to clean their stethoscope. Think about that.
Sure. They
go room to room to room and patient to patient using the same naked stethoscope. Ask them to wipe it or sanitize it. And make sure, talk to housekeeping. When housekeeping comes in, if you ever notice, if you're in a hospital, watch what they do. A lot of times they don't do the bed rails, they don't do certain doorknobs, they just kind of skim through and mop the floor, and that's about it. Ask them to make sure to deep clean the bathroom, or ask them to do your handrails. Make sure they get all those doorknobs. And a family member can do that. And also make sure it's hard to walk in those little booties. I have fought it. I've wanted to walk barefoot when I walk the hall. Don't do that. Look at the bottom of those booties if you're ever in the hospital. The floors are filthy, so there's a lot of bacteria sitting on those floors. But another thing you can do, too, one of the last things I discovered is although before most surgeries, people are given some type of antibiotic to stave off any possible infection, but in a very busy hospital, it can be forgotten. So 24 hours before that surgery, ask a nurse or a doctor, am I going to get IV antibiotics? So that's just a few things, excuse me, that people can do to help themselves, to help the situation, because it really takes everybody. to help fight this off. There are some things I know you will not help getting and that are out there that seem to be out there to get us, but I think we can do a good job, too, of helping fight this.
Yeah. So, hey, Mary, how do you feel today? Because you sound very sharp and very knowledgeable, and so it's how do you feel today?
Actually, today has been a good day. I do have my good days and bad days.
Mm-hmm.
There are some days when it's very difficult to even get out of bed because of the joint pain, excuse me, or the fatigue. But there are some days when I'm really on. Excuse me. Some days I'm really on. But there are some days when, you just don't want to deal with the public. You don't want to deal with anybody. It depends. I think a lot of it is the medication. The infection is sitting there doing its thing, but Cipro has so many side effects, and I think part of it is a little hard to blend into what is the medication that might be part of this post-sepsis syndrome. That is something that doctors don't talk about and don't really recognize, and there's quite a bit of literature out there on it. So. But, and that's me in a nutshell, hoping that your radio program gets out there and really, helps people realize this is not a fun thing, and it's it kills more people than breast cancer and AIDS and prostate cancer combined, so we need to get out there and scream it, yeah.
And it's very timely, as you said, that, September is Sepsis Awareness Month, and that starts tomorrow. So, and I also want to encourage listeners, if they want to check out Mary's blog, it's called Living with a Hospital-Acquired Infection and Health, and that can be found at hospitalinfectionsandhealth.wordpress.com. And I'll put a link on the website if you want to go check that out. And I want to thank you, Mary Millard, and God bless you and your family, and hang in there, okay?
Well, I really appreciate it. It was very interesting being here, and I really hope that the listeners check that out and really are aware of what can happen.
Thank you, Mary.
Thank you.